welcome back to the Smart Start Recreational Therapy Insights YouTube channel. My name is Nathan Lemaster and I am the founder of Smart CU's Hub and your host for this year-long video series. I hope you've enjoyed the last episodes we've done so far, talking about various aspects of recreational therapy. And as we dive deeper in the following weeks, we're going to talk about skills that a recreational therapist must possess and attitudes and all of the above. So if you are a recreational therapist, some of that basic stuff's now out of the way. Now we're going to get into more depth. Okay, so without any further ado, let's dive right in. All right, this week we're talking about person-centered care. And why does it matter? Okay, so why does person-centered care matter? That is the question we're going to answer. Okay, person-centered care is all about recognizing each client as a whole person, rather than just a diagnosis or a set of limitations. Here are some key reasons. It's the cornerstone of recreational therapy. All right, number one, client empowerment. Okay, so when clients have a say in their treatment, they're more motivated to participate and are more likely to follow through with the interventions and things that you give them. All right, involving them in decision making can boost their own self-confidence, autonomy, and overall satisfaction. Number two, tailored interventions. A one-size-fits-all approach to recreational therapy just won't do it, folks. So by focusing on individual goals, we can select the most relevant and engaging activities for that person, maximizing the therapeutic benefit. And number three, the enhanced therapeutic relationship. Collaborating with clients fosters trust, rapport, and a sense of partnership. All right, how many times have you actually met with somebody and immediately started telling them what to do and how to do it? That's not really how things work. Okay, so when you develop a friendship, a relationship of any kind, right, first you want to get to know the person. Act like you give I don't want to say that word on this video, but act like you care about what it is that they're dealing with, what they're going through, who they are, what they do like, what they don't like. Okay, and take a real big interest in them, because truthfully, you're without a job if it isn't for them. Ultimately, person-centered care and treatment planning means that we're not just doing things to clients, we're doing things with them. It's a subtle shift that can transform the therapeutic experience. Right, now we're going to talk about some steps on how to do person-centered treatment. Let's walk through the key steps creating a person-centered treatment plan. As we go along, remember to just revisit the assessment data that you collected at the very beginning, and it serves you as a roadmap to these individualized goals, as we talked about in previous episode. Okay? All right, we're going to collaborate on goal setting now. We're going to review assessment findings. Start by discussing the client's identified strengths, needs, and interests. We're going to co-create goals. Ask open-ended questions like, what would you like to achieve in the next few weeks? Or what activities would you most like to do yourself? Okay, and then we're going to align with SMART criteria. Yes, SMART. Anyways, goals should be specific, measurable, achievable, relevant, and time-bound. Okay, guys, so when you create goals, they got to be measurable. That's what you're going to be doing to track progress along the way. Side note, at Smart CU's Hub, when we create the courses that are on the site, so our instructors create these courses, every single course has objectives that are measurable and meet these SMART goals, so that later in the quiz, they actually test that you understood them. Okay, so without these measurable goals and a way to measure them, these goals are kind of irrelevant. So, all right, number two, we're going to select targeted interventions. Match interventions to client needs and preferences. Example, dance therapy for a music-loving client who needs to improve balance, or nature walks for someone who finds calm in the outdoors for someone who's struggling with anxiety. That could be 2 ideas right there. And then an evidence-based approach. Whenever possible, refer to those journals that we spoke about in the previous episodes that show the research behind what it is you're doing and why you're doing it. All right, and then you're going to adapt and grade just like we do whenever we do the APIDE process. We evaluate how well the activity or intervention went for the client and what it is that they are supposed to be there improving. And then we're going to kind of change it. So we're going to offer adaptive equipment, adjust rules, or simplify tasks to match the client's functional level. And then as the client improves, you might even add a little bit of challenge in there. You're going to gradually increase the difficulty or complexity of the activity to keep their interest, to keep them on that state of flow. Because as you know, as their skill increases, they might not enjoy or find the activity as enjoyable because it no longer challenges them. All right, and then we're going to integrate client feedback. Okay, we're going to do check-ins with the clients during sessions and ask them about how they feel about the activity, what's working, what's not working, what should we change, those types of questions. And then we're going to adjust the interventions based off of that feedback. If something just isn't clicking, we're going to collaborate on changes that might make the activity more enjoyable or comfortable for the client. All right, that brings us to collaboration and documentation. So person-centered planning also involves collaborating with family members, caregivers, and other professionals. Here's how. Okay, so number 1, family and caregiver involvement. So family and caregivers are the ones that are closest to the client typically, and they can give you some insights that maybe even the client themselves is not aware of, or maybe they're not able to articulate these things. So families often know their past hobbies, their preferences, their triggers, things that maybe might be the thing you should avoid. Leverage that and to refine your interventions. And then at-home strategies. We're going to offer suggestions for leisure or coping activities that can be practiced outside or in a clinical sessions, reinforcing their progress. Okay, we're going to collaborate with the interdisciplinary team. So other therapists, psychologists, nurses, everybody else that works with these clients, we're going to collaborate with them because some of their goals that they've come up with the client and some of the goals that we've come up with our client, right, they might be better matched together so that we can actually achieve them even better and reinforce these improvements as we go along. Okay, and then we're going to get regular updates, exchange progress notes and feedback from these team members because we're all in this together ultimately to serve the clients. And then we're going to do documentation and goal tracking. So that's the progress notes and the goals that we have for the patient and the at the end to see how it's doing the evaluation. Okay, so we're going to record the goals, interventions used, the client responses, and any adaptations that you made. So if you changed something about the intervention for the specific client, what was that and why did you change it? Is that something that you should do for future clients maybe that have something similar going on? And then you're going to evaluate and adjust. So check in regularly on the goal progression. So typically in a hospital setting, that would be every week. So like once a week doing a progress note, or maybe every day doing a daily progress note. That could be useful. And if they're in a long-term care setting, so like a nursing home, where they're not going to be leaving very often, you might do quarterly. That could be the most appropriate, just to see if things are not getting worse. Maybe some things are actually getting better. Maybe their overall quality of life has been improving. So that's awesome. All right, by keeping these thorough records and fostering open communication with our clients, we can ensure the plan remains dynamic and truly person-centered. All right, now for the recap and takeaway. We're going to recap the points that we made during this video. We're first, a person-centered approach, so it shifts the focus of client autonomy, empowerment, and individuality. Co-created goals is number 2. We're going to engage clients from the outset, aligning treatment objectives with their personal values and interests. Number 3, we're going to adapt and grade. Meet clients where they are, then gradually increase challenge to promote their growth. Number 4, collaboration and documentation. We're going to work with the families, the treatment team, the caregivers, all the people that are involved to get all the information needed and to reinforce these goals and progress as we continue to treat the client. All right, thank you guys so much for another week of the Smart Start Recreational Therapy Insights YouTube channel. I am hopefully getting a little more comfortable on camera, and hopefully you're able to see that at home. And hopefully you're finding these videos actually interesting and useful for you as a recreational therapist. I love the fact that I get to do these videos, and I'm actually finding them fun to make now. So that's kind of a cool side benefit. Learning about the thumbnails for the courses, or not for the courses, thumbnails for each of the YouTube segments so that we can make them more attractive and make you want to click them. But hopefully you are liking them and you're finding them interesting. The length isn't too long. Everything about them is just right. Okay, so guys, please, if you can, please like, subscribe. So like the video and subscribe to the channel so that you get these videos every single week. It really does help with growing this channel and making it a useful resource for all recreational therapists. And as always, and I always like to end each of our episodes this way, guys. So since this goes out on a Monday, have a good rest of your week. And as always, recreational therapists, stay classy.